Psoriasis is more than just a skin condition. It's a chronic disease that can affect your entire life. If you've recently been diagnosed or have been living with it for a while, you know how challenging it can be. Psoriasis causes patches of red, scaly skin that can itch, burn, and sometimes even crack and bleed. It commonly appears on the knees, elbows, scalp, and lower back, but can pop up almost anywhere. But here's the good news. While there's no cure for psoriasis, there are plenty of ways to manage it. Treatments can help control flare-ups and minimize symptoms, and lifestyle changes can make living with psoriasis easier. In this video, we'll dive into everything you need to know, from what causes psoriasis to how you can treat it and live well with the condition. Number 1. What is psoriasis? Psoriasis is a chronic, long-lasting autoimmune condition that speeds up the life cycle of skin cells, causing them to build up rapidly on the surface of the skin. This results in those signature itchy, scalpy patches we mentioned earlier. For some people, psoriasis is just a minor irritation, while for others, it can be a major life disruptor, interfering with sleep, work, and social activities. The tricky part about psoriasis is that it's unpredictable. It can flare up for a few weeks or months, then calm down for a while before returning. Even though it's a common condition, millions of people worldwide have it. It's often misunderstood. The most important thing to know is that psoriasis isn't contagious, so you can't catch it from or pass it to someone else. Number 2. What are the different types of psoriasis? Not all psoriasis is the same. In fact, there are several different types, which with its own symptoms and challenges. Flake psoriasis is the most common form. It causes those familiar dry, raised, and scaly patches, usually on the elbows, knees, and scalp. The patches can range from small areas to large sections, and the color can look different depending on your skin tone. Other types include nail psoriasis, which affect the fingernails and toenails, causing them to pit, discolor, or even crumble. Guttate psoriasis is more common in children and young adults and look like small drop-shaped spots on the trunk and limbs, often following a strep throat infection. There's also inverse psoriasis, which causes smooth, inflamed patches and body folds like the armpits or groin. Rarer types like pustular psoriasis and erythrodermic psoriasis can be more severe and require immediate medical attention. Number 3. What are the symptoms of psoriasis? The symptoms of psoriasis can vary from person to person. Some people might only experience a few dandruff-like flakes, while others can develop full-body rashes that are itchy, painful, and hard to ignore. Most common, psoriasis causes patches of red or purple skin covered with silvery white scales. In people with darker skin, the patches can be purple or gray. You might also notice dry, cracked skin that can bleed or feel sore. One of the most frustrating things about psoriasis is how unpredictable it can be. Symptoms often flare up for a few weeks or months before subsiding for a while. The cycle of flare-ups and remissions can make it difficult to plan around your symptoms. Knowing your triggers and managing stress can help reduce the frequency of flare-ups, but the condition often comes and goes on its own schedule. Number 4. What causes psoriasis and what triggers it? The exact cause of psoriasis isn't fully understood, but researchers believe it's linked to an overactive immune system. Normally, your immune system protects your body by fighting off infections. But in people with psoriasis, the immune system mistakenly attacks healthy skin cells, causing them to grow much faster than normal. Instead of the usual weeks-long process, skin cells in psoriasis sufferers turnover in just a few days, leading to the buildup of patches and scales. While the underlying cause might be immune-related, certain factors can trigger psoriasis flare-ups. Common triggers include infections like strep throat, injuries to the skin, thin cuts, scrapes, or sunburns, and cold, dry weather. Smoking, drinking alcohol, and stress can also contribute to flare-ups. Even certain medications such as lithium or anti-malarial drugs can trigger psoriasis. Understanding your personal triggers can help you manage the condition better. Number 5. What other health risks are linked to psoriasis? Psoriasis doesn't just affect your skin, it can have a broader impact on your health. One of the most serious complications is psoriatic arthritis, a condition that causes joint pain, stiffness, and swelling. If you have psoriasis and start to notice joint discomfort, it's important to talk to your doctor because psoriatic arthritis can lead to permanent joint damage if untreated. People with psoriasis are also at a higher risk of developing other health conditions. These include cardiovascular disease, type 2 diabetes, high blood pressure, and even depression. The connection between psoriasis and these other conditions is still being studied, but it's thought that the inflammation associated with psoriasis may play a role. If you have psoriasis, it's important to keep an eye on your overall health and get regular checkups. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. How is psoriasis treated? While there's no cure for psoriasis, there are many treatment options available to help manage the symptoms. Topical treatments such as corticosteroids or vitamin D analogs are often the first line of defense. These creams and ointments are applied directly to the affected area to reduce inflammation and slow down skin cell turnover. For more stubborn cases, phototherapy or light therapy can be effective. This involves exposing the skin to ultraviolet or UV light under medical supervision to slow the growth of skin cells. If your psoriasis is more severe, oral or injectable medications might be necessary. These treatments work by suppressing the immune system to reduce inflammation. Biologics, a newer class of drugs, target specific parts of the immune system and have shown great promise in treating psoriasis. Alongside medical treatments, lifestyle adjustments like moisturizing regularly, managing stress, and avoiding triggers can help keep flare-ups at bay. Number 7. How can you live with psoriasis and cope with it? Living with psoriasis can be challenging, but with the right strategies, you can keep it from taking over your life. A solid skincare routine is essential. Use a good moisturizer daily to keep your skin hydrated and avoid harsh soaps or shampoos that can irritate your skin. Also, be mindful of any product or fabrics that might trigger irritation. For those who experience scalp psoriasis, using a medicated shampoo can be a game changer. Stress is a major trigger for many people with psoriasis, so finding ways to manage it can help reduce flare-ups. Activities like yoga, meditation, or even taking time for yourself to unwind can make a big difference. It's also helpful to build a support system. Whether it's through a psoriasis support group or talking to a mental health professional, having people who understand what you're going through can ease the emotional toll psoriasis can take. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.